Okay, what is the opposite of stigma?
I will say that it's like pride, like being proud of being positive and what you do with it.
For me, inclusion
Mm.
and respect.
Yeah.
How do you decide whether or whether not to tell a healthcare provider or a service about having HIV?
Yeah, I always think how relevant is me disclosing my status. Obviously, my HIV doctor knows. But if I don't know, seeing an eye doctor or like a skin doctor and they ask me, I think what they're going to do with that information. And usually I choose not to unless they're going to prescribe some medication. And because of interactions, I feel that I have to disclose.
Yeah.
But in general, I choose not to.
How do you handle intrusive questions?
Do you mean like when people ask us how we got HIV?
Yeah.
So, I mean, it depends on the day and it depends how I'm feeling. I can just say by accident, or sometimes I can push back and really ask, like, why are you asking me that? Like, why is this relevant? Because it becomes a really loaded question and it's hard to come back from that and feel safe because they're not being upfront with what they want to know.
Mm.
I've got friends that don't even access health services in order to keep themselves safe.
So how can healthcare workers make services feel safe for people living with HIV?
I think it depends on the service, but there are a lot of signs when you take the intake form. If they ask you about your sexuality, if they use inclusive language, you feel safe because you know that they're making it safe for you. For me, words are very important. The way people use language in a safe way, it's very important. Let's say, for example, someone asks me if I'm a drug user or how's my mental health. And I say, like all good, or I'm not a drug user, and then they make a judgmental comment towards that community, that will immediately put me off because I know that it might do that to me once I leave the room. All those little details make a big difference.
And when you do tell a healthcare worker about having HIV, what does a good response look like?
So a good response is no reaction, or they can talk about privacy and confidentiality, which shows me it's not a big deal to them, but also they're fully aware it's important to me that I know what I'm talking about is going to be kept private and safe. So what about you, Liz? What do you think is a good response to a HIV disclosure?
Well, a bit like what you just said, if it's not an HIV-related issue, then it doesn't need to be written down or passed on to anyone else in notes or in handover or even in referrals. Sometimes I've seen that staff have put HIV positive on a computer alert, but once I explain it's not necessary and why, they understand. It's always a really good teaching opportunity. And if the person's talking to me about an HIV-related issue, I think asking them if they're happy with their HIV care is enough, or asking how I can help. Let the patient drive the conversation.
As health professionals, we practice standard precautions, and standard precautions means that it's across the board. So if you are working with a client who is HIV positive, you use standard precautions, whether they're HIV positive or they're not HIV positive. It shouldn't be an issue if you are cleaning up blood or you're doing wound care. Everybody should be treated and cared for in the same way using standard precautions. Nobody should be treated any differently.
There is so much that health workers can do.
Yeah, well, we can show that we understand how important people's privacy is in relation to their HIV, and if there's a reason we need to talk about HIV and there are others in the room or within earshot, say, we can be discreet, we can check if it's okay to talk about it, or we can say your health condition instead of actually using the term HIV. And how can healthcare workers be allies for people living with HIV?
The best allies that I've found are the ones that understand that we do actually sometimes face challenges when accessing services. So one of the other things that allies can do is only ask us questions about HIV when it's relevant to the health issue we're there for, and then explain to us why it's relevant and why it's necessary.
So speaking about allyship, how can services and workers be allies for people that live with HIV?
I think it's really important just to remember that questions can actually do harm, and they have done harm. You actually think about why you're asking those questions. And whether it's actually relevant to that person's care that you're planning on providing or that you're working with them. And it's not just out of pure curiosity. Because HIV has changed so dramatically over the years, we need to make sure that we are up to date in our knowledge. We can increase our knowledge in many different ways. And also sharing that knowledge with other health professionals. It's about us educating ourselves about HIV and not expecting our clients to do that for us.
And can you talk about good experiences that you've had in health services?
So for me, the best experience is when people have at least a basic knowledge of HIV. They understand transmission, they understand treatment, and they're aware of U equals U.
I see it in two ways. And one, if I go to something that has nothing to do with HIV, then HIV shouldn't come up. So if I leave without talking about HIV, that's a good experience. And then the other one would be if it maybe is related with HIV or the way it's asked, if I feel that I was treated as everybody else would, that's a good experience. Because sometimes you feel that because you live with HIV or because you disclose, people change their attitude and they treat you differently. And that's a bad experience.
What's the opposite of stigma?
When I read this, because I've got that question too, the word help came, that was like the first word that came into my mind. Yeah.
Okay. I was going to say justice. I don't know why too.
That was when I read it. Joy, again, I don't know why.
Funny. I thought that too. I seriously did.
Oh, wow. Well, then I'll ask you,
So
what's the opposite of stigma? Joy. Yeah, because stigma is hate, right? So the opposite is joy.
Yeah.
So on the same page this time.
I seriously did.
Yeah.